Hello, and welcome to Shadow Me Next, a podcast where I take you into and behind the scenes of the medical world to provide you with a deeper understanding of the human side of medicine. I'm Ashley, a physician assistant, medical editor, clinical preceptor, and the creator of Shadow Me Next. It is my pleasure to introduce you to incredible members of the healthcare field and uncover their unique stories, the joys and challenges they face, and what drives them in their careers. It's access you want and stories you need. Whether you're a pre-health student or simply curious about the healthcare field, I invite you to join me as we take a conversational and personal look into the lives and minds of leaders in medicine. I don't want you to miss a single one of these conversations, so make sure that you subscribe to this podcast, which will automatically notify you when new episodes are dropped, and follow us on Instagram and Facebook at Shadow Me Next, where we will review highlights from this conversation and where I'll give you sneak previews of our upcoming guests. Today, I'm joined by Jono Lippman, a physician assistant with an amazing journey into medicine. After starting as a communications major in college and working as a wilderness guide, Jono eventually discovered his passion for healthcare through wilderness first responder training. Now he practices in emergency medicine and rural critical access hospitals, where his role is both dynamic and autonomous. In addition to his clinical work, Jono is the creator of the PA Guide, a resource that helps PA students manage the overwhelming content of their coursework and develop critical thinking skills. His goal is to transform medical education by offering a more structured and supportive approach, empowering students to avoid burnout and succeed in their careers. In this episode, Jono shares his unique path, lessons from his experiences, and how he's helping shape the future of medical education. Please keep in mind that the content of this podcast is intended for informational and entertainment purposes only and should not be considered as professional medical advice. The views and opinions expressed in this podcast are those of the host and guests and do not necessarily reflect the official policy or position of any other agency, organization, employer, or company. This is Shadow Me Next with Jono Lippman. Hey, Jono, thank you so much for joining me today on Shadow Me Next. I am thrilled to talk to you about not just your career and your job, but what you have created. Thank you for joining us this morning.
You're welcome. I think this would be fun. Let's get into it.
Let's get into it. Awesome. Okay, so let's start at the beginning. What drew you to medicine and being a PA in the first place? Was it a challenge for you to kind of arrive at where you're at right now?
Oh, totally. So I am what I would describe as when I was in PA school, the weakest candidate in my program, and a career change student. So I was a communication major. I avoided science my entire college undergrad experience because I hated it so much in high school, and put it off to my last semester of my senior year of college. And then at one point in college, I was like, oh, maybe I should go into medicine. And I don't know where the thought initially came from, but then I was like, nah, I'm watching too much Scrubs. That was it. And then I talked myself out of it. I didn't know what a PA was then. This was I graduated 2009 from college. So I worked for a decade or so doing I was an outdoor adventure director and a backpacking guide, and I would work with students and do a lot of programmatic stuff and really, really enjoyed it. Thinking that at some point I was like, oh, maybe I'll become a teacher because I love teaching. I love just engaging students where they're at and challenging them. So I was like, oh, maybe I'll become a teacher. So looked into the process of doing that, and my thought was, oh, I'll become a teacher, and then over the summer I'll run my own high adventure program, backpacking program or something like that. That seems like a cool life. So I did to open up more opportunity in the wilderness side of things, did a wilderness first responder course, which is a very basic, kind of like an EMT course for the wilderness. And it was a week long camping out, doing basically didactic courses for what we had to learn. And I walked away from that. I'm like, whoa, that was super cool. I really like that. I want to do that, but I hate science. So what do I do? And so I just kind of like, I was like, well, I guess I'll get my EMT license. I'll do that next. And so I did that, all the while still doing this outdoor stuff, and just had this thought in the back of my head, like maybe I'll do this, maybe I'll do like my mom was a nurse. She went back to school when I was in kindergarten. So I saw someone change their career before, and I saw how much work it was. Um, so I had this interest, I had this thing going in my head. I was like, oh, I'll do this. But then I kept talking myself out of it. And then I had like two kind of events that, or a couple events that pushed me in their direction. One is I got married. My wife was working at Starbucks and I was working full time and she was making more money than me. And I was like, well, I've got to figure out something to make more money.
Hmm.
Um, and then I was working in these situations where I'm telling students all the time, like, hey, step outside your comfort zone, step outside your comfort zone, push yourself, you could do it. And I was like, well, what's outside my comfort zone? And my first thought was taking a science class. I was like, ah, fine. And then my wife eventually was like, you just need to like shut up, stop talking about this and sign up for a class. And so then being 27, signing up for a community college bio 101 class where I did not remember what the mitochondria was. I did not remember what osmosis was. Like I didn't remember any of this stuff. And I did chemistry. I'm like, I hated that.
Hmm.
And then got into anatomy and physiology and just loved it. And all that time I was thinking, I'll be a nurse. Like that just makes sense. My mom was a nurse. I'll be a nurse. My wife was thinking she'd be a nurse. Um, and so we're kind of headed in that direction. I started working with PAs and I really liked the PAs I was working with. We seemed to get along. I should keep going down that route. And then at some point I realized I qualified for PA schools, and ended up applying to 22 of them. Then I got in and then um, got through it. And we can talk about that experience. But I've been a PA for over 5 years now. And here we are.
This is the number one question that I get from pre PA and actually just pre health students, generally speaking, is Ashley, do you think I'm behind? These are usually juniors or seniors in college who have almost all of the prerequisites already needed to go to the graduate program of their choice, whether it's PA school, medical school, etc. And I'm just so grateful and so inspired by your story because you didn't take a science class in college until the last semester. And then after that you were unsure and you were just trying the things that you were interested in, right? And I think
Mhm.
that there is this pressure to rush through and get in and get accepted so
Mhm.
quickly. And
Mhm.
I'd love to know what your thoughts are on this because I'm sure you counsel students on this too, but life happens in between those periods, right? And the things that you learned working as a wilderness first responder or an EMT likely shaped who you are now as a PA. What do you tell those students?
I'll answer in two ways. One, I directly tell a lot of students because they say, what do I need to do for my gap year? And my response is, you need to put the term gap year to death
Mm,
and you need to go live your life. Because the challenge now that PA students are facing is not that they're 40 years old and they've been a paramedic and now they're like, how do I go back to school? They're 23, 24, and they're going up against every other 23, 24 year old who has basically pre-med um, qualifications that's now
mm-hmm,
applying to PA school. So how do you set yourself apart from that? The only way to set yourself apart from that is have actual life experience. Actual life experience doesn't necessarily come from patient care experience for a year as a tech or an MA or something. It is actually going out and building a story because that's what your personal statement is. That's what your interview is telling your story so you can stick out. What I ended up experiencing early on in my career, like post grad life,
mm-hmm,
was massive burnout.
mm,
Um, it to the point that I had this very idealistic job that everyone who like I went to undergrad with was like, oh, cool, you're doing the thing. Congratulations, what an amazing job. Everyone, growing my network, having all this opportunity. And at one point I was like, I hate this so much. I would go to bed and be like, I don't want to wake up. I would go on vacation or like go on home for break. I'm like, I would get like anxiety. I'm like, I don't want to go back. Um, and eventually it was my mom saying like, Jono, I love you. I just don't like you right now. Um, which is just brutal, but my mom's Armenian and that's just, you know, the way it goes. That I quit. and I bought a ticket to Europe with no plan. And I nearly almost bought a one-way ticket. The
Mhm.
only reason I came back is my cousin was getting married, but I traveled for about 7 months, functionally homeless. I slept on trains. I slept on streets. I worked for housing and food. This was not an influencer trip. This was not an impressive trip. I lived out of a Nalgene that I would make oats and coffee in. Um, and I during this whole 7 month process, I spent, this is including travel and everything, $2,000. Um, right. So
Wow.
like this process was so good for me in the sense of one, having a burnout experience where my ideals were crushed, and then having to kind of like recollect myself after that and being like, how do I move forward now that I'm in, like, I've had a quarter life crisis. I don't know who I am. I don't know what I want. And I think something like that is really good for, and I wouldn't say everyone needs to go through that experience, but having an experience where you see your ideals challenged, and your goals really just derailed.
Wow. Burnout is something that we talk about so much. I mean, we talk about burnout so much in medicine, but I don't think people understand the results fully of
Mhm.
burnout sometimes,
Mhm.
and I spoke with a physician a couple of episodes ago, Dr. Todd Otten, and unfortunately for some of his colleagues, the result of burnout was physician suicide. These are big deal things that we need to
Mhm.
address. And I'm
Mhm.
really excited to hear, to talk to you about some of the ways that maybe we mitigate some of those feelings
Mhm.
of frustration, I think clinically, how we can feel like we're not just making a difference maybe in clinic, but making a difference for those who are coming after us. And I'm really excited to talk to you about that. Before we jump into that, though, I want to go back to one thing you said, about how you really were introduced to the PA profession by seeing other PAs,
Mhm.
and not just seeing them, but also seeing yourself in them, right?
Mhm.
And that is the importance of shadowing. And that is
Mhm.
the importance of talking to so many different clinicians in this field of medicine, and why I encourage students, if they think they want to be a PA, do not just shadow PAs. You need to also get experience with medical doctors. You need to get experience
Mhm.
with nurses, with NPs, with occupational and physical therapists, speech language pathologists, phlebotomists, ultrasound techs, all of it. Because like you said, a lot of times why we choose the profession is because of the other people in that profession, people we jive with, people that just make sense to us. So thank you. Thank you for bringing that up. That was a really, really
Yeah.
great point. Let's talk about a day in your life. So you work in emergency medicine, and it sounds like this is a multifactorial job for you. You have a lot of
Mhm.
roles. Walk us through maybe what that looks like, and what, maybe not just one day, maybe
Yeah.
a couple of days in your life, because it sounds like they're very different.
There's two roles I play now as an ERPA. One is, like you said, quintessential, like in a city. There's a couple hospitals that I rotate through, and my schedule is set out a year in advance. We have like a template. So I kind of know what's coming, and I either work early mornings or swing shifts. The ER is, it is what comes. Like it, I could walk in and there's 20 patients waiting, or I walk in and there's nothing happening. But I could go from seeing just completely benign, unplanned primary care is probably the best way to say it, of just like someone has a sore throat, someone has a rash, to someone is coding. And with
Wow.
the ER group that I work with, they encourage PAs to do whatever they're comfortable with. And then, we have a certain criteria of, if it's this concern, just bring the physician along and say like, hey, by the way, I have a 65-year-old male who's presenting with chest pain. I think he's having an MI. Just putting this on your radar, and the physician will say, cool, thanks. And then we're all on the same page. If it's something that I'm really not comfortable with, then I can grab the physician and say, hey, you need to come see this patient. But so I manage everything in those settings, from coughs to sepsis and everything in between. And then procedure wise, do whatever I'm comfortable with. So that's including centralized intubation, lumbar punctures, paracentesis, thoracentesis, stuff like that. I still like go back and forth in my head of like, do I really like shift work? I'm not really sure. I kind of miss the like 9 to 5 life,
Mhm.
and the predictability of it. But I also, in a work setting, I enjoy coming into my day and being like, I don't know what's going to happen. So I do that. And then I also contract and do, the best way to describe it is rural emergency medicine, autonomous coverage of hospitals. Critical access hospitals serve people that are generally like 2 hours outside of town. And so these are small hospitals that generally have like emergency department. They have a couple like their own small ward. They generally don't have an ICU. I'll go and some of those shifts are super quiet and not a ton happens. And then other times I have people that are truly sick or going through true traumas coming in. I'm the person there and I'm the person there managing it. So I'm doing it completely alone. So there are two different kind of ways of approaching emergency medicine and I enjoy both of them. They both have their different sense of intensity. They both have their like kind of safety nets that come with it too. Yeah, so there's no day in the life. There's just like show up and it's time to go.
No, exactly. In my brain, that's what emergency medicine is, right? Do you think that working in the critical access hospitals helps when maybe you're feeling not burnt out, but just kind of exhausted and tired in the big, larger main hospitals and vice
Yes.
versa? Are the roles
Yeah.
a little bit different? You think they complement each other kind of?
Oh, totally. Yeah,
Yeah.
I mean the critical access one pushes me because I have to make the decision. I have to deal with these things, but it's not these hospitals generally they get federal funding because they're serving a population that is way out there. And so the critical access ones are much slower. And so even if I have someone there, as long as they're stable, if I'm concerned about something, I have the time to do the workup with them and to order the procedure or order the imaging, order the labs, work through the things, just, really spend time and sit with them and reason with them. Working in the rural autonomous critical access hospital has made me much more confident making hard decisions for patients, especially when they're in that gray area. Working in the local setting, especially working with really, really great physicians, has made me much more refined at this point. Because I think what I would initially do here is like someone come in, I'm like shotgun workup, give them everything. One of the doctors I work with says something like the large workup is the last safety net of the incompetent, and I'm like, oh, ouch.
Ouch.
Whew. And so he's always challenging me to refine what I'm doing, to really ask the question, like, well, what are you looking for? And so now here, when I work in the autonomous setting, and then the rural setting, I think I'm much more focused on what I'm doing, because I know what I'm looking for, and I'm able to use clinical reasoning and the history and the physical exam, to work through my differential and like, clinical scores to work through my differential instead of just like order all the imaging, order all the labs, check, 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 check. Person's not going to die. Great. Get them out. Like,
No, exactly. And I'm sure your patients at the critical access hospital are appreciative of that because I would imagine that financial insecurity at those locations is probably a little bit more prevalent. And God, healthcare is expensive. It's so expensive, and if we can refine that for them, then at least, the weight of the finances perhaps is a little bit lighter. And all they have to worry about is, well, the weight of being sick, which is heavy enough. Tell me about how you said you've been working for 5 years as a PA. How has your perspective of medicine, especially working in these two locations, how has it evolved over those 5 years working as a PA?
I think the things that, and you touched on this really briefly earlier too, is like there's the culture of patient care, but then there's also the culture of medicine. And the culture of
Mhm.
medicine is how we teach it, how we train people, how we mentor people, how we treat our staff. And I think both of them are super broken. I had about, 6 months of normal medicine when I graduated, and then COVID happened. And
Mm.
I still don't think we have fully reckoned with how that has changed everything culturally, medically, in some good ways, but exposed the cancer or the infection. And people are like, wow, that's really bad. And then no one's dealing with it. Or
Mhm.
people are dealing with it, but they're not dealing with it in a fully robust way, or they're afraid to deal with it.
Pay for product. That's what
Yeah.
medicine is right now. And
Yes.
that's not why I do it. That's not everybody's experience. And I would love for medicine to get back to, well, I don't know, helping people. Um, it would be
Mhm.
it'd be really nice. Okay, let's
It
pivot.
would, it,
Let's pivot.
yeah. Yeah.
I have talked to at this point, dozens of healthcare providers, of clinicians, and all of them use this phrase at some point or another, drinking from a fire hose when it comes to their education, right? You are the creator of the PA Guide. It's a comprehensive board review course tailored for PA students with the goal of fostering critical thinking and clinical reasoning. Tell me how drinking from a fire hose, how does this concept play into what you do and why you do it?
So I'm going to address your question by first saying it's like drinking from a fire hose is a stupid cliche we use because we are too lazy to try to change things in medicine. It is like drinking from a fire hose because we're disorganized. Yes, medicine is a lot of content, but no one has tried to make a system to make this not necessarily easier, but simpler. The example actually I would give you is if you in our families, like we're gonna go backpacking, we're gonna go into the mountains. I would not say, Ashley, there's the wilderness. It's like drinking from a fire hose. You'll figure it out. I would say, Ashley, here's the map. Here's where we're going. Here's where we're going to take breaks. Here's where we're going to stay for the night. Here's what we're eating. Here are all your tools. And now let's go. And so I would give you a system and a pathway, and I would guide you through the process, right?
Mm-hmm. Mm-hmm.
So why don't we do that in medicine? Because the other kind of attitude and cliche that people have in medicine is, well, I've suffered through this. Therefore, you should suffer through this.
Mm.
And I brought that up to a friend, and he's like, that is literally the cycle of abuse. So we are abusing and burning out our clinicians, our future clinicians in nursing school, medical school, PA school, any school, because we don't say, hey, let's do this differently. So I don't believe in the drinking from a fire hose mentality. So I made these duct tape journals for every system, cardiology, neurology, pulmonology, whatever, that were hideous and homemade because I couldn't find what I wanted. But I ended up doing really well. And I did really well to the point that I was class president. I ran a student-run clinic. I was the one, I was like, sometimes in lectures, like I felt like Hermione Granger, like just like arm up, like I know the answer. We're in like endocrine, hematology, these things that are like really high reasoning, really challenging, interacting with these attendings, not just PAs, but like, the hematologist of the hospital. And I'm like, I get it. I know where we're going. Whereas all these other students, or a lot of other students in my course were checked out because they're overwhelmed. So I ended up doing really well. And actually I never studied at night. I took a day off every week. Like books closed, did not study. I was able to do this really well. It was a really positive experience for me. So I created an outline and a notebook to help students filter through the information. A lot of people liked them. A lot of people bought them. I had students in Canada, the US, and the UK who were like, these are really cool. What a great tool. I don't know how to draw. And so then my thought was like, well, I guess I'll illustrate these. Um, That'll take me a little bit. So then 2 years later, I have illustrated a 600 page, about 1,000 illustration board review notebook, all based around the pants. Every section is laid out with pathology, patient, diagnosis, treatment, space for notes, and an illustration to help you comprehend and understand what you're learning. That's not like, it's not a super pathological drawing. It's just like a basic image of what you're going to see. And then one of my friends who's not medical, he works in business and marketing. He's like, hey, I love this. Let's make a course. And so we've partnered together and we created PA Guide, which includes this notebook, which is designed to help students know what's coming. It is the map. It helps them filter through what they're doing. It helps them stay productive, hopefully get excited about what they're learning. And then we've developed a course, and the course is designed around the pants. We have a didactic section. We've designed a clinical pharmacology section to go with the didactic section. We're designing end of rotation exam. Then we also created an AI chatbot to go with it as well. And the chatbot is basically like an attending. And the idea with that is then students can kind of go through the process when you're learning a subject of what I would advise any student to do for this fire hose experience is get our notebook, get our course, go through our overview, take notes on it, go through the course, take notes on it. We have quizzes, do some quizzes, take notes on that, practice with the bot on that subject, take notes on it, then sit and lecture. And if you go through that 4 different times, different directions, take active notes on it, get your mind around the subject, and then sit in the lecture on that subject, then you're going to be the student that's like engaged, locked in, knows what's coming, knows the board content, knows what you need to know for the test already. And then you're able to kind of pick out like, okay, what's a test pearl? And then what's a clinical pearl of like, I need to remember this and just take a note of this. So I remember this when I'm practicing. And so I want to make people in medicine thoughtful and I want to help young students and busy parents become really good at clinical reasoning fast and quickly so that they can get out there, not burnt out. And I want to, like we talked about, like the world of medicine, like there's patient care and then there's the medical culture. I'm not changing Medicare and Medicaid. I'm not touching insurance, but this culture, the culture of education, I want to see that change. I want to see that change across the board. I want to be done with the cliches like, nurses eat their young, or you'll figure it out, or it's like drinking from a fire hose. I want people to actually mentor each other and care about each other and train the next generation because I've seen the failure of that. I've experienced the failure of that. That's what PA Guide is.
It goes back to, I think originally, a ways back when you thought perhaps education and teaching was what was going to be in your future. Meeting students where they are is what you said. And this whole platform does exactly that. Because as we know, there are some people who are visual learners, auditory learners, people who learn more by writing, people who learn more by reading, right? You are able, with your platform, you're able to meet that student where they are and then give them a map, like you've said. And I think that guidance is so sought after right now. And many PA programs do offer incredible support. I went to the University of Florida PA school, and I can tell you, I felt very, very supported. But when it comes to somebody say, Ashley, do this next, Ashley, consider learning this way instead of that way, there really wasn't, it was a lot of, well, you kind of figure it out as you go, just like you said. And I've heard so many people say that. So this resource for people is incredible. Have you had good feedback? What's been the feedback on this?
One professor had a student that she said, I was meeting with the student every week. He was really struggling. He would be at the school from 7 a.m. till 9 p.m, doing all these things. And then the student came and brought this notebook and said, hey, professor, this is a game changer. And she's like, I knew it was a game changer because I never met with him again.
Wow.
Yeah. So she told me that and I was like, oh, yes. And then, do you know Eric Fogg?
Yes, Eric, he was on the podcast not too long ago. He's fantastic.
So him and I have become buddies because what I'm doing spans the gap of what he's doing and what pre-PA coaches do is a lot of people are helping people get into school. Eric is incredible at helping people who are just really, really struggling. And I'm with PA Guide trying to stand in the gap. He's been really encouraging. I think from students, it's been really positive. People who've gotten their hands on it and committed to it. Everyone learns differently, but there's so much learning that students are doing right now of PA school, medical school used to be like textbook, lecture. That's it. Now it's textbook, lecture, TikTok, Instagram, YouTube, podcasts, like all these different things that people are trying to filter through of all their learning styles. And if you just had something where you're like, oh yeah, what was that thing on lactose intolerance? And even the physical process of like not scrolling through a document on your computer and an Excel chart or like it is literally like, what was my thing on toxic megacolon? Oh yeah. Okay. Let's annotate that. Like the physical process of hearing that or reviewing that thing and being like, oh yeah, this is it. Okay. Physically pull out my book and like mentally engage with this. It gave me a lot of control over my education. And I want to give that to students.
It sounds like you have the perfect resource for those students that are currently in school going, what do I do? Where am I going from here? I think it's great. Jono, where can students find this book? Where can students find your platform?
Yes.
How do we get our hands on this? Now, before we hear our quality question and before we hear where we can get our hands on this incredible resource, keep in mind that there's more interview prep, such as mock interviews and personal statement review over on shadowmenext.com. There, you'll find amazing resources to help you as you prepare to answer your own quality questions. Now, Jono and I did not discuss a quality question, but his work with the PA Guide highlights the importance of creating structured, accessible resources to help students navigate the complexities of medical education. By addressing these gaps, he's paving the way for a more thoughtful and effective approach to training the next generation of healthcare professionals. So the quality question is this: what aspects of healthcare education or training do you think are currently missing? To answer this question, think about the challenges you've faced in your own education, maybe something you've heard from an older student. and where you feel support or structure might be lacking. Consider how you might address these gaps, either through new resources, mentorship, or improved systems that could better prepare future healthcare professionals.
The website is pa-guide.com. We'll eventually probably spend however thousands of dollars to get rid of that dash, but right now it's pa-guide.com. We have a bunch of free resources on it for students that are starting off. I am on Instagram, TikTok, LinkedIn, YouTube, X.
Jono, thank you so much. I so appreciate all of the time that you've spent, not just developing your platform, but also chatting with us about it and telling your story. It's just chock full of gold and truth and honesty. And it shows people that there is not one way to do things. And just because your way is a little bit different than somebody else's, it absolutely does not make it wrong. It makes it very right for you. So thanks so much for sharing that.
Oh, you're so welcome. This was a pleasure.
Thank you so very much for listening to this episode of Shadow Me Next. If you liked this episode, or if you think it could be useful for a friend, please subscribe and invite them to join us next Monday. As always, if you have any questions, let me know on Facebook or Instagram. Access you want, stories you need. You're always invited to Shadow Me Next.